Hi, and welcome to the Voices of the South. This is the podcast where we interview social innovators from the Global South and the people who support them. In this podcast, you will learn a little bit about the history of the social innovator, their project, and the change they have created. Thank you for hearing us and be sure to enjoy the episode. Modern blood transfusion is arguably one of the most important medical innovations of the last century. From the trenches during World War One to the modern hospitals that treat people who live with conditions affecting their blood or who have suffered severe blood loss, thanks to this innovation, we have been able to save countless of lives. However, for people to benefit from the existence of blood transfusion, it is necessary to have access to the donated blood. And this is where things can get a little bit complicated, especially if you happen to be in the global south. According to the World Health Organization, there is a marked difference in the amount of blood donations happening in the global north when compared to the global south. The countries of the global north usually get around 31 donations per 1,000 inhabitants. Meanwhile, in the global south, it's usually between 5 to 6 donations per 1,000 inhabitants. This lack of donations has facilitated the appearances of black markets, profiting from blood transfusions and lowering the quality of the donation, which in turn can affect the quality of living of the patients and the people around them. This black market phenomenon is currently ongoing in different places in the world, with Nigeria being one of the countries that is affected by it. Thankfully, the situation that Nigeria and other countries in the global south are facing is not hopeless. And today, our guest will talk with us about how she, alongside her team, has created an organization that focuses on making blood donations and transfusions something accessible for everyone. So it is my pleasure to introduce Bolarinwa from the Haima Health Foundation to the Voices of the South. Welcome, Bukola. I hope that I pronounced your last name correctly. If not,
Thank
please
you,
let me
Carlos.
know.
No, good attempt. Good attempt.
Well, as I was mentioning before, it's a pleasure to have you here. I'm glad to tell you that you are the first project that comes from Africa.
Oh,
And
great.
it's a really big landmark for us because
Yeah.
for some reason it has been so hard to
hmm
get social innovators from Africa
Yeah.
to agree to the interview, which I hope that's a trend that is changing with you.
Yeah.
And welcome to the program. Welcome to the
Yeah.
Voices of the South. How
Thank
about you start telling us a little bit about you and the project?
Yeah, sure. So my name is Bukola. I have a condition called sickle cell disease. Sickle cell is an inherited blood condition that you're born with. And it basically means that your red blood cells, instead of your red blood cells being round, they're in a sickle shape or a banana shape. And what that means is that they don't carry oxygen properly around your body. So that causes a host of complications, the most common of which is pain. One of the treatments for sickle cell disease is blood transfusions, which is kind of how I got into this space. So I've been doing sickle cell advocacy for a long time now, going to 12 years, supporting a community of people living with sickle cell disease in Nigeria and in the UK. And a lot of the challenge for people living with sickle cell when they're in that condition is trying to get blood. So the way it works is if you are having, say, a sickle cell crisis and you go into the hospital in Nigeria, it's very common for the blood not to be available. This can even be more challenging if you're a rare blood group. So if you, so example, your blood group is O negative or your blood group is AB negative, for example, um, they might not have your blood in the blood bank. And what usually happens is you will then have to reach out to your family or your friends or your community members and say, hey, I'm at the hospital. Please, can somebody come and donate for me? And that's a very traumatic process for patients, especially when you're in pain yourself. You know, you're still having to reach out to people, or your family members are having to reach out to people to donate blood. So what we did in the beginning was we said we would create a database of people who would be voluntary blood donors. And so We started with just our friends and families, putting them on the database. Every time somebody needed blood, we would call somebody on the database and say, hey, this person needs blood. They're O positive and you're O positive as well. Are you available to go give blood? And that's how we started. Unfortunately, that didn't really solve the problem because there's a lot of reasons. People move around. People, for example, have donated today with blood. If you can only donate 4 times a year. So even if you donate today and another patient comes in a month's time, you're not eligible to donate for another couple of months. And so what we decided was we need to work more on getting the message out there to Nigerians about how important it is to donate blood. So we started doing a lot of advocacy campaigns. We started mostly focused on universities and campuses and what we call NYSC, which is a National Youth Service, and going out to them and saying, hey guys, do you know how important it is to give blood? It's only going to take 15 minutes of your time. And with each donation, you have the potential to save up to 3 lives. And that's how we started, going around spreading the messages, doing radio campaigns, doing TV adverts, and TV interviews. And then with the advent of social media now, we do a lot of social media marketing as well, trying to get young people to sign up as voluntary blood donors. We organize monthly blood drives in several states in Nigeria. Again, trying to take the blood drive to the people so they don't have to say, oh, I'm too busy to come and donate blood. We'll be right at the place where you are. We partner with a lot of organizations like churches, like mosques, like corporate organizations who want to do CSOs and so on, to meet them and say, hey, let's organize a blood drive with you so that whoever is around you will come and give blood. And so that's what we do now. In addition, we recently, about a year and a half ago, also started doing logistics for blood, which is where we pick up blood for patients that are in hospitals at the nearest blood bank and we deliver it to them. So that's those really the three things that we do around that. And that's kind of the background of how I started this journey.
Yeah, I mean, wow. I
Mhm.
read a little bit about the sickle blood uh, cells.
Sickle cell disease. Yeah.
Sickle cell disease. It's yeah, it sounds quite complicated to deal. I don't know if there's different degrees of
Hmm.
yeah. I don't know if you have like different count of
Yeah,
yeah. So I guess the more sickle shape or banana shaped cells that you have, the more complicated it gets,
exactly.
and
Exactly.
backwards now.
Yeah.
And I was reading about the phenomena that was happening in Nigeria about the blood for money that
Yes.
it's being called,
Yeah.
and how a lot of families has, well, it's either letting your family member have a really bad time, physically speaking, or inclusive dying,
Hmm.
or paying money to get people to donate
Yes.
blood.
Yeah.
And as you say, if you happen to be on one of the really rare blood types like AB or negative O, I suppose it must be the stress on that situation must be oof, crazy.
Yeah.
I didn't knew that you were living with this situation, with this sickness, that you were living with this condition. But thank you for sharing that. It's a very personal fact about you that you
Yeah.
share with the internet, which
Yeah.
we know that the internet is never gonna do anything bad about that.
Yeah.
Uh, but it's impressive that you started with this idea of, hey, I know that other people is suffering with this or is living with this condition. Let's try to make it easier for everybody, especially when you're talking about a country that doesn't have as many donations. So all the culture of donating blood is not as prevalent as it would be in the global north,
Yeah.
where you have people that are donating. I mean, again, 31 donations of blood per 1,000 inhabitants against 6 or 5.
Yeah.
It's a world of difference. Another thing that I would like to also bring upon is how you started to leverage the community, how you
Hmm.
went to the universities, how you went to the churches, how you went to these hubs of people and started to inform and to give a little bit of the culture about why it's important to donate your blood. And we will talk about the whole blood donations, transport and blood donations, sort of like logistics that you are increasing now, that you and the Hamta Foundation are increasing now, which is amazing. But that's for later in the interview. I Right now I want to focus a little bit on the team that is with you, on the team that is working with you. Obviously, I suppose that you are not alone,
Yeah.
but I imagine that when you started with this, you were yourself, and I don't know who else, but it would be nice to know about the team that is working with you.
Yeah, so I never started by myself because before we started this, we were already a community of people living with sickle cell disease. So I started through an organization called Sickle Cell Aid Foundation, and what we were doing at that time was supporting people living with sickle cell and raising awareness about sickle cell disease. So we already had a community of volunteers, and a lot of the volunteers as well also were living with sickle cell disease, or they had family members who were living with sickle cell disease. So it was we already had kind of built that community. And then what we would then started doing was we saw this problem that was very particular around blood. And then I said, you know what, I want to focus just on this blood challenge, and then carried a number of people who were already working alongside with it. So like my team members, Ayo, Ife, Ike, and Tochi in particular, I have to shout out to them because they do a lot of the groundwork in particular, were people who had either personal experience living with sickle cell or had family members who were living with sickle cell disease, or were just really connected to the cause and then joined us to kind of tackle this blood problem. So I would say that we were a bit lucky in the sense that we had personal motivation to solve this problem. It wasn't like a far away problem that we didn't have any personal experience with. It was something that we felt, and we felt within the community. So it kind of makes the driving force easier when even when things are kind of challenging and you're tired, because you have the personal experience, you know how important it is.
Yeah, I definitely imagine that having close persons, close people to you, dealing with this symptom or similar symptoms, it's a very good motivator
Yeah,
to go through the hassles, especially on the starting
yeah,
of an organization.
yeah,
I don't know if you care to share a little bit about these hassles that
yeah,
you have to go through with the
yeah,
organization to make it happen.
yeah,
I don't know what was one of the biggest challenges that you got
yeah.
at the beginning.
Yeah. So I would say there are lots of challenges. The first one is when you're trying to solve a problem that feels too big. I think that sometimes if you're a social enterprise, and you have a narrow remit, it's a lot better. So in the beginning, we just kind of felt like we just want anybody who needed blood. That's our ethos anyway. It's like we want any patient who needs blood in the hospital should have blood available. But it's such a big problem, and you're dealing with so many like layers of problems within the healthcare sector as a whole, and trying to decide which aspect of this, excuse me, am I going to tackle is, I think, the biggest issue for a lot of CSOs and NGOs. And I think it's the reason why a lot of people quit, or a lot of people start it as a passion project or as an NGO and then do it for several years and then you quit because it doesn't feel like you're making any progress, right? Because most of the time the problem is too big. And so for us, we just felt like let's like kind of break it down into three main problems that we're trying to solve. And I have to shout out to a program I took part in called Queen's Commonwealth Trust Fellowship. The fellowship is for young change makers, and I think it was very helpful as well in helping us kind of create a strategy for what we were trying to do, break down the problems that we're trying to solve into bite-sized pieces, and set tangible goals for ourselves. Because if you don't set tangible goals, it would always feel like you're putting water. It's a Nigerian saying. I don't know if they say this, but it's like pouring water into the ocean, right? You're not really seeing any impact because it's too big. And so we decided that we would start from one state, which was Abuja, decided that we were going to have monthly blood drives. And then from there, we said we're expanding to Lagos, then from Lagos to Kano, then from Kano to Kaduna. And then as you do that, then we first started with we want to have just one blood drive per month. Then from there, we decided we want to collect this amount of units of blood every month. So at least we know that in these particular places, this amount of units of blood is being collected every month. And so I think that would be the first thing is as a CSO, as an NGO, the problem that you're trying to solve, how can you break it down into bite-sized chunks so that you can then at the end of the year do some kind of monitoring and evaluation and say, we set out in the beginning of this year to collect 400 units of blood. How many units of blood did we end up collecting, right? And then being able to kind of say, okay, this year we collected 400 units of blood. Next year we want to collect, 800 or 600 units of blood. So breaking down the problem that you're trying to solve into bite-sized chunks, I would say, and creating that strategy for yourself is one of the biggest challenges as a CSO, as an S. And then number two is obviously funding. For a lot of people, there's very few things that you want to achieve that you don't need money, right? Like even if it's not like, and for us, like blood donation, as you know, is not something that's very expensive in the sense that you're giving it for free, right? Like people are coming to donate blood, and we're partnering with hospitals and blood banks to collect blood. But even if you just want to do advocacy, you need to spend money because you're using people's time, you're using resources, you're going from place to place. And so as an NGO, it's like creating a budget and then saying we need this amount of money per year. How are we going to achieve it? What are our fundraising strategies to achieve it? Is one of the, I would say, again, a big challenge, right? If you're trying to raise money and you're not successful, it's very easy to quit and just say, you know what, I tried my best. I could never just raise enough funds to do it. So I would say those are the two biggest challenges we faced in the beginning.
Hi, this is Carlos, the host of the Voices of the South. The Voices of the South is a small project that mainly works thanks to the help of the people around the team. So if you like this episode and would like to help us, we will appreciate it a lot. The best way to help is to share the interview and subscribe to the podcast so other people can find us. Anyhow, thanks for being here and let's go back to the episode. Yeah, I remember when I started my own innovation, I was like, oh yeah, I want to bring food sovereignty to everybody. And then you sit down and it's like, that's a little bit more complicated than it
Yeah.
is, isn't it? Which I think is probably where you're also going. Like, yeah,
Yeah.
we want to make blood transfusion available and accessible for everyone that needs it. But then the everyone becomes the actual problem,
Yeah.
and you need to learn how to divide it by bites, as you
Yeah.
were saying. Um, I'm glad to know that there was somehow of a support structure for you to go and be like, hey guys, I want to do this. Can you help me with that?
Yeah.
Because sadly, that's not something that it's often that open. I don't know if you access it through it by your university or by your studies institution. Because I remember that for me at least, my experience on accessing this knowledge was first throughout my university and then throughout winning some awards and stuff like that, that they also gave you some learning opportunities from those topics in specific. And you would probably not let me lie, when once you start putting indicators, once you start wanting to create an impact indicator, well, things get really complicated. Not everybody is able to properly understand the topic and to create something that actually reflects the work that you're doing.
Yeah. No, I think that, so that again, like that fellowship was really great. But for those that don't have access to a type of fellowship, everything is on YouTube. I tell everybody that everything is on YouTube, right? You need to be able to, because if you have to look at social entrepreneurship or like running an NGO as an enterprise, right? And and I'm saying this, I learned this after doing um NGO work for over 10 years. I was just volunteering, just doing the work. We weren't recording anything. We weren't thinking about impact or matrix or anything like that. Um, but even when you do want to access some of these grants or access some of these fellowships, they will ask you for your impact, right? They will ask you how many people have you reached out to. So, if, for example, if you want to do agriculture or you want to do any of these types of things, it's like, okay, how many farmers have you spoken to? How many surveys have you done? You know, how many people have listened to the advocacy that you've done? So, and sometimes it might feel like the thing you're doing isn't tangible enough to be measured, but everything is measurable. And I learned that going through this fellowship and going through this process and seeing seeing my enterprise as seeing the NGO and the process that we're doing as an enterprise. So part of what they also encouraged us to do was to get board members, right? And so we got board members who were like experts, like senior experts who had been working in the field for a long time. And we have meetings with them every 6 months or every 4 months, and I just report to them and say, this is what we're doing. And then they give us feedback and say, okay, instead of doing it this way, why have you thought about doing it this way? Have you thought about doing that? Do you know what I mean? Just having people allow you to be accountable and having people who are looking at things from a corporate perspective and allowing you to bring that corporate lens to your social enterprise or to your NGO, I think is a really very important is a very important step. And I would encourage anybody who's starting out or who's already in the process of the social entrepreneurship journey to look at it that way.
Yeah, there's definitely some things that the social innovation and the social entrepreneurship field can take out from normal entrepreneurship. I'm currently in my life, I'm trying to figure out an in between social entrepreneurship and social innovation,
Mm-hmm.
mainly because the word entrepreneurship sometimes can be taken out of context,
Mm-hmm.
and sometimes people start understanding social innovations as something that has to give you uh, I don't something back. Like you
Mm-hmm.
put out an investment and you need to get dividends at some point.
Mm-hmm.
And that might work for some projects, that might work for some ideas, but not for all of them.
Mm-hmm.
But I totally agree with you on the, yeah, you need to learn, you need to take the pieces that you need to use and work with these
Mm-hmm.
uh, to be able to achieve the goal that you have.
Yeah.
Uh, and the talk about if it is social innovation or social entrepreneurship is neither here or there for this conversation, but I think it's a conversation that is worth having at some point in life.
Yeah.
Thank you very much for sharing that. Again, I'm really glad that there is an option for social innovation and social entrepreneurs in Nigeria. I don't know if that program is still going. I hope it is, because it seems that it helps a lot.
Yeah.
Again, when we started, I was like, I want to do this.
Yeah.
How? I don't know. I'm not going to do it. But we're going into the middle of the interview now.
Yeah.
This is the part I really like because this is where we bring to shine both the biggest success for you and
Yeah.
also biggest failure or the fucked up
Yeah.
moment. Now, the fuck up moment is not for you or anybody that is listening us to be like, ha, ha they fucked up. No, it's a learning space where you share this moment of crisis of the organization, this moment of crisis of the that you had in the project at some point. You learn from it, and
Mhm.
you manage to overcome it or to adapt to it,
Mhm.
and now you are here
Mhm.
working with this. And if I don't remember badly, you are a Shoka fellow, right? You are
Yeah.
part of the fellows.
Yeah.
Yeah. So yeah, again, for those people that haven't heard about what is to be an Ashoka Fellow, well, it's a lot in the social innovation field. Being a Ashoka Fellow, it's something. Like it's not everybody reached there. So yeah, the whole point of this section of the interview is that to show people one that every success count. Like it might not be the yeah we arrived and we managed to give to secure 1,000 blood transfusions this day. It might be something more personal. It might be I managed to help a friend of mine that just wouldn't be able to make it. It something relatively small but important for you.
Mm-hmm.
And then the fuck up is with the idea of, well, yeah, mistakes happens. Sometimes they are bigger than we would like to be, but they happen.
Mm-hmm.
And we grew up from there and we learn from there.
Mm-hmm. Yeah, so I would say starting for the first one, there was a lady who had sickle cell disease and she was going to have a baby, and she reached out to us a few days before and said, "Hey, I'm going to have an elective cesarean section, and we need blood donors." So we were able to send her some blood donors. Um, to donate blood before she went through the CS, and then she did it. It was successful. And she sent us a picture of her baby and she said, "I want to send this to you just to thank you for all you guys have been doing." And it was such a little moment, but for me, I always go back to that as something that is one of the drivers of what we do, because I think she didn't, in Nigeria, the way they do it is if a woman wants to give birth in the public hospitals, they'll ask you to bring your husband to donate blood. Again, it's just a way to kind of motivate people to give, because oftentimes, women who are going to have babies, they might need blood transfusions, and a lot of people don't give blood. And so those kinds of stories are like super small, and this happened a number of years ago, but it stays with me. When a patient comes out of the hospital and says, "Hey, thank you so much for helping us look for a donor. Thank you for going through this process with us when we were searching for a donor. I didn't know this type of service existed." For me, it validates the reason why we're doing what we're doing, right? Because then it's like, okay, so what we're doing matters, and it's impactful, and it's noticeable to the lives of the patients. And that for me is a biggest driver. Um, in terms of the biggest kind of fuck up, or the biggest um thing that we didn't do well, that one is a little bit more difficult. I would say there have been moments where we kind of ask ourselves if what we're doing is enough. And I think every social entrepreneur struggles with this, right? Where you look at yourself after working in this space for 10 years, 7 years, 5 years, and you ask yourself, in the bigger picture, and remember in the beginning I was talking about breaking down what you want to do into small pictures, into small bites, and then you do the small bites over a number of years, and then you look back, and then you ask yourself, like, in the grand scheme of things, how important is this work? Like, how much have we actually moved the needle? And I think for me, that's always a question that I struggle with. And it's not necessarily like a one moment of, oh, we didn't do this right, or like a necessary failure. It's more of a case of like big picture and long-term impacts, and then asking yourself, like, if this work stopped today, um would we have created a sufficient enough kind of impact that it would be missed? And I think that's something that I still struggle with. It's like, it feels like when you're doing things as a social entrepreneur on such a small scale, you regularly ask yourself, um like, what the big picture is, what the goal is. And it feels sometimes like that keeps moving. And like it feels like you will never arrive at that point where it's like, yeah, we have arrived and we have solved, blood donation crisis, or we have solved climate change, or we have solved food security. And it's more of like an existential type of problem. And I think for me, that's something that I really struggle with, and I know that a lot of other social entrepreneurs struggle with. I know it doesn't answer directly like a single fuck up or a single thing, but for me, that's more of my biggest kind of challenge.
No, no, no. Don't worry. Don't worry about that. photops and victories can have so many different meanings for so many different people. For some of the interviews, one of the biggest victory was like, yeah, and we then managed to sell our first corporate forest, and it was so many trees that we didn't really know what to do with it. And but some for some others, it's something personal. Like for you, is this one lady that was gonna have a bird, a seasick, but you said that it can be. I mean, with modern medicine, is not as dangerous as it was in the past, but it's still a dangerous surgery. And the same thing goes with this kind of hot dogs. In this case, is a existential one. In this case, it's something that haunts your dreams
Yeah.
probably
Yeah.
because it's how and when it's gonna be enough.
Yeah.
Uh, uh, but no, I totally understand. I totally understand where you're coming from. I very much remember in one of these many workshops that I had, they were comparing the goal of a social innovation, a social entrepreneur, as something akin to Avalon. For those who don't know, it's the mythical island in the Arthurian legends, where it's an utopia. It's where everybody's happy, nothing bad is happening, but nobody can really access to it because you need to be very specific person to be able to access to that place. But they tell you, hey, that's the goal. That's what you want to work for. Whatever if you reach or not, don't think about it. Think
Mm-hmm.
about creating the path.
Mm-hmm.
Think about transforming the long path that we have to reach there.
Mm-hmm.
That again goes back into what you were talking about, no? Like we need to have small victories. We need to have small sections of the road where we
Mm-hmm.
can sit down and be like, yeah, it's not the entire mountain, but it's getting there,
Yeah.
getting there.
Yeah. Yeah. It's that constant conflict, I think.
Yeah, it happens to everybody. But in your case, it's a conflict of, hey, we maybe we haven't been helping enough people,
Yeah.
rather than, oh yeah, my bank account is not, it doesn't have enough zeros, you know.
Yeah,
Uh,
exactly.
which, if you ask me, your existential question is way better than the other one. Thank you for sharing this with us. Thank you for letting us know what has been for you
Yeah.
this journey as a
Mm.
social entrepreneur. This wasn't in the interview, but I'm really curious. How do you think the culture of blood donation affected your program in Nigeria? Because
Mhm.
it's different every country that
Yeah.
you go.
Yeah.
I mean, in Mexico, we still have, I hope not anymore, but when the last time that I donated, there was still LGBT people weren't allowed to donate,
Yeah.
which is something that was adopted back in the 60s, maybe.
Yeah. Yeah.
Uh, Meanwhile, in Sweden, LGBT people, as long as they go throughout the testing, the blood testing that everybody needs to go through,
Hmm.
and they pass it, they can donate. So I don't know if Nigeria has something similar
Yeah.
in your side.
Yeah. So you're absolutely right. Like the culture of blood donation is very different. I mean, in Nigeria, for example, if you have a tattoo, and you've had a tattoo recently, because of the risk of hepatitis, you can't donate for a year after you get a tattoo. In a lot of other places, that those rules don't exist. So it really just depends on the different countries, and the eligibility criteria is different. So, for example, in Kenya, secondary school students 15, 16 can donate blood. In Nigeria, you have to be 18 to donate blood. So those things are like the eligibility criteria varies from country to country. But I think the biggest thing is more about the culture around blood donation. A lot of people don't donate blood because of the fear of donating blood and because of the mistrust of the healthcare system. So there's a general kind of fear that if I go to the, blood bank, or if I'm at a blood drive and they're using needles, they're, taking my blood, is there a risk that I could get an infection? Is there a risk of HIV? Is there a risk of hepatitis? And all these other things. Because in the past, there have been issues around blood safety. And people don't forget those things, even if it happened 15, 20 years ago. I know that the Nigeria is doing a lot better now in terms of transfusions and screening of blood and all those kinds of things. That fear still lingers in people's minds, and I think that it's a real deterrent to people coming up to donate blood. And in addition to that, in Nigeria, there's just a kind of general fear of blood. Blood is associated with kind of traditional religious practices like voodoo and things like that. And people kind of, they ask these kinds of questions like, oh, if I donate blood, what are you going to do with the blood? That means that there isn't like a real trust around the system. And trying to get people to go past that fear is extremely difficult, which is why a lot of our advocacy campaigns have been focused on universities. Because when you meet someone, they're 17, 18 at a university, they're a lot more open-minded, they're more receptive to learning, they're more kind of curious. If they see their friends doing it, donating blood, they'll be like, okay, yeah, um I don't mind doing it. And we usually say that first donation is usually the hardest. So trying to convince someone who hasn't donated before to come to donate is the hardest. Someone like you, who has donated in the past, if I come to you again in a couple of years and say, oh, would you like to donate blood? You'd be like, oh yeah, I did it, a couple of years ago. I'm happy to do it again. So trying to get them converted, like we say, to do that very first donation is the hardest. And so we are really trying to focus more on young people. We know that um, sometimes it's a Herculean task because it really is wider than blood donation. It's generally the healthcare system and distrust of how things are done that is discouraging people. But all we can do is kind of encourage them and say, you can donate or not donate. And we're also always working with the agencies to improve their eligibility criteria and to try and make it, easier for everybody to donate. I know in the past, for example, women were discouraged from donating because women go through monthly menstrual cycles, which means that they do lose a bit of blood on a monthly basis. So generally, women would have lower iron levels than men or lower hemoglobin levels. Um, but that isn't enough reason to just kind of rule out all women, because even despite some women going through periods, a lot of women can donate. I would say that the greater majority of the people that donate to us are women. And so again, it's like that education around like eligibility is very, very important.
That's impressive. The last fact that you mentioned, that the majority of the people that donate are women,
Yeah,
it's something interesting because as far as I understand, usually the majority of the donation of the people that donate is men or are
yeah,
men because of different barriers that women
yeah,
have to go through to be
yeah,
able to donate. One
yeah,
of them is a menstrual cycle.
yeah,
So I found it super interesting that the majority of the donors are women
yeah,
in this case. It's
yeah,
quite cool.
yeah.
Thank you for sharing that.
Yeah, they're usually more interested and compassionate. They tend to get screened out more, so I do agree with that. For various reasons, like we had earlier mentioned. So if a woman is pregnant, for example, she can't donate. If she's breastfeeding, she can't donate. If she's currently on her period, she can't donate. Or if she, went on her period like a day or two before, she would usually be told not to donate. So women do have stricter eligibility criteria. And if, for example, a woman has had a baby and had a blood transfusion herself, she will not be eligible to donate in the future. So women do have a lot more reasons to be screened out than men. But in terms of the willingness to donate and the willingness to sign up to donate, women definitely be a lot more.
That's really nice to hear that there is a sense of community.
Yeah,
In this case, is being reflected more in the women's side of
yeah,
the society.
yeah,
But it's good to know that despite these multiple barriers to be able to donate, they are still invested, and they are
Interesting.
trying to do it.
Yeah.
Yeah, which is what brings us to the next section of the interview. We're really close to finishing, but it's the future. I would love to know what is the plan that you have, that
Yeah.
you and your organization have for the future.
Mhm.
I was reading on your webpage that you are already helping with the mobilizing or the logistics behind getting donations from one place to another, which again, I'm not an expert on any kind in biological material or medical transport, but it seems complicated. Like you have to have boxes that are
Yeah.
approved by the WHO.
Yeah.
Care to share a little bit about that? That
Yeah.
seems
Yeah. So, but again, this also came out of a need where sometimes there's a patient in a hospital, let's say they're in location A, and the blood is available, but it's in location B. And the way it currently works is that the patient would have to send their family member to go pick up the blood, either using a taxi or using a bus, and then bring it to them. That's kind of the way it currently works. And so, obviously, this is really inefficient and very stressful for the patients because a lot of the blood banks um, or the hospitals don't have their own logistics. And so we said, you know what, um, we got a small grant, and I said, let's buy a motorbike and see how efficient it would be for us to help the hospitals or the blood bank to transport the blood. So we started with one bike, and we realized that there was a need, but not just a need for transporting blood in a safe manner, but also to transport medical samples, transport medication, to transport things that needed to be in cold chain. And so we worked with our partners who are the Lagos State Blood Transfusion Service and say, hey, we want to do this. Would you be interested in partnering with us? And they were, and they kind of coached us through what we needed to get, the types of medical transport boxes that we needed to get. We went through a testing process, they approved it, and then we started moving blood and blood samples for them. And from there, we've kind of expanded to now having 4 bikes, and we're doing it for a lot of private organizations as well, and they are paying for that service. So in terms of, like, to answer your first question, the future, it's really trying to think of how we can make this service enough to run the social enterprise. So to charge enough um, to be able to cover the costs of all the other work that we're doing around hosting blood drives, advocacy work, and all those kinds of things. Because as you kind of deepen into the social entrepreneurship space, you realize that sustainability becomes an issue, right? Is that you can't keep, looking for grants, looking for donations. We still do that for sure, but you need something to kind of, help fuel the what you're doing on a more sustainable basis.
everybody needs to eat. That's thing that sometimes we forget about when you're doing a social entrepreneurship, social
Exactly.
innovation. It's like, yeah, I can do it, and
Yes.
then it's like, I'm hungry.
Yes. Yes. And then you can do it for the first year, then the second year, and the third year. But then when you're getting to like the seventh year, like we are in now, it then becomes a case of, okay, how do you make this more sustainable? How are you able to plan for your future? And so we're hoping that by having this service and having it, obviously it has to be a paid service, right? Because it's operations, you need to buy fuel every day, you need to pay the riders, you need to, maintain and service the bikes and all the other costs that comes with it. The clients will pay for that service, and we can use hopefully any excess we have or any profits that we make from that venture to fund all the other work that we're doing in the blood donation space. So that's the plan for the future at the moment. You can come to me in a year and ask me how it's going, and maybe we would have changed the plan, or maybe you decide that this particular plan is not working. But yeah, that's our short-term plan for now.
I mean, plans change,
Okay.
especially in the social innovation, in the social entrepreneurship area. Something always happening that is like
Always, always.
that
Something is
thing.
always changing, honestly. But to be fair, even if you work in the corporate world, you realize so much changes all the time. Like you start off with plan A, and then sometimes you have plan B, C, D, E, and none of those even work. So you have to remain nimble, and you have to just, like I always say, just try it. If it works, fine. If it doesn't work, you try something else.
Yeah, if it doesn't work, learn from it and yeah, and keep going. That is true.
Yeah.
Okay, thank you very much. I would love to have a second chat with you in a year or something like that to talk
Yes.
about how is it going.
Yes.
Um, in general, the idea, the organization, the goal seems amazing. I'm so glad that you've been working for 7 years. Um, if you know, I don't know if you know, but if you know how many people have been benefiting from your work and the work of the organization, how
Mhm.
many blood donations have you make an
Yeah.
impact?
Yes. So we've collected over 4,000 pints of blood across all the states that we've done. And what's amazing is that with each pint of blood, it has the ability to save up to 3 lives because blood can be separated into components. So sometimes a patient can need just the platelets. So if you have a particular conditions, for example, patients that have certain types of cancers, they just need the platelets, and then that in that same pint of blood, another person just needs the plasma, and another person just needs the red cells. So that's what's amazing is that even with one person donating 1 pint of blood, that pint of blood can go to different patients using it for different using it to treat different conditions. So we love that aspect of it. So we've been able to collect that amount, and we've been able to expand to six states, like I said, to host blood drives. We have over 60 volunteers at the moment that are working with us in different capacities and in different states. And for us, when we look at the kind of reach that we've had on social media, we're talking going into um, a million or millions of people that have kind of engaged with our posts on social media and kind of learned more about blood donation through the work that we're doing. So for us, we know that like the work that we're doing is making an impact, and we can see it in the lives of the people that we're touching and in the units of blood that we're collecting. And so for us, that's what fills us with joy and the motivation to keep going.
Yeah, humble brag there. 1 million people in social media. That's
Yeah.
crazy. Congratulations. And let alone the social media, just the amount of blood that you've been able, that you and your team have been able to collect and provide to other people. Amazing. Congratulations to everybody there. Such a nice work. Okay,
Thank you.
so let's go to the closing. Thank you for being with us. Let's start with the question of what would you recommend to new social innovators, social entrepreneurs that are starting and they don't really know what to do? What would be your first recommendation to them?
Like Nike, you just do it. Just do it. Like I always say, so many times, you, what do they say? Good is better than great, in the sense that it's better to start something and it's good versus you're planning and planning and planning for something great and you never get it done. Failure to launch, as they say. Um, it's very important to me that you get started. Don't wait until you have enough money. Don't wait until you have enough time. Don't wait until you have enough team members. Don't wait until you have an office space or whatever it is in your head that you think you need in order to start a social entrepreneurship journey. Just start. Just start. It just takes one patient, one client, one person to take a chance on you, and you're on your way. So I think for people who are, especially people who are overthinkers or over planners, social entrepreneurship may be a bit of a challenge because whatever it is you think you're planning for is gonna go another way. And whatever it is you think, you came up with this perfect strategy on how you're gonna do in Q1 and Q2 and Q3. I remember we had all these plans and then COVID just happened, and then we had to kind of re-strategize. how do you have a blood drive during times of social distancing, right? When people are told not to come into contact. And that was in fact, it was a very challenging time because it was the first time we had the blood banks that we were working with had zero blood, like zero, like there was no blood in the blood bank for almost 2 weeks because there was nobody coming to donate. Meanwhile, the patients still need the blood, right? Like a lot of patients are still falling sick, they still need blood. And so that's when we had to now come up with this social distancing blood drives where we had to have only one person in the blood bank at a time come donate, we'd ship them out, then schedule the next person in. And so it's just like you have to know that no matter, you can have the best laid plans, and planning is great, strategy is great, but always be ready for your plans to go, haywire, and then be very nimble in picking yourself up and trying something else and trying something else and trying something else. So for me, I would say just start from your bedroom, start from your little, Excel sheets that you want to try. Just start. Don't wait until you feel like you have all the ducks in a row, or you have or everything you need figured out. That would always be my biggest thing.
Yeah, as you said, it's good to plan, but it's also good to be able
Yeah,
to adapt. I would say that that's a really good advice, because yeah, nobody was expecting the COVID pandemic to happen. No, like everybody was doing their own business, and then surprise,
yeah,
everything
changes.
changed.
Yeah, yeah, and
In
then it changes back again. So
Yeah,
just be nimble, just go for it, start it, and don't be afraid of failure. Honestly, like I think sometimes we usually idolize people that we think have it together, but you need to ask them how many fails things they have done before they get to that success, right? Like, don't think that the first thing you're going to do is going to be successful. It can be the seventh thing, it can be the 10th thing, and it can be nothing in that field that you're looking at is successful, then you have to pivot into something else totally. So just be open and to success, and be open to failure as well.
yeah. As you say, maybe it's not even the seven. Maybe it's the 7.5. That
Yeah,
is the one that kicks it. So like something that you didn't thought it was
you
gonna
didn't
be
think
there,
about it.
but
Absolutely.
that's a niche. Yeah. Let's go with the last three questions. What would you recommend to people that doesn't want to be a social entrepreneur or a social innovator, but wants to help?
Yeah.
Apart, obviously, than donating blood and participating, we will go to that one. But what would you recommend to these people?
Yeah, so join an organization that's already doing work that you find interesting. You don't always have to start everything. You don't have to reinvent the wheel. Like when I started my sickle cell journey, I was working with an organization as a volunteer. And then when the founder left, then I became the president of that organization, and I led the organization for a number of years. So don't feel the need that you have to start. I think sometimes joining an organization, either as a volunteer or as a team member, is also a great way for you to learn how to run an organization. It teaches you how to see the ins and outs, how to execute programs, how to plan, how to fundraise. And then when you then, take all those things, if you decide later that you want to run your own organizations, you're already equipped with all the tools that you need. So I would even say that that's a great way to start. You don't have to start your own thing immediately. Join an organization that's already existing, and learn from them. It's as simple as that.
That's a good advice for everybody who wants to do something,
Yeah,
but doesn't really want to take on the leading role.
yeah,
That can be taxing. That can be
yeah.
tiring. Go and help somebody else. Okay, so how can people support you and your project? How can they reach you out?
Yeah, so you can follow us on social media. It's Haima Health. So it can be Haima underscore health or Haima Health on all social media platforms. Um, you can because at the moment we're only working in Nigeria and a little bit in Ghana. If you're not in those countries, then you won't be able to obviously sign up to donate blood, but we would love for you to kind of help share our message. And wherever it is you are, like, organize a blood drive, go donate blood, register as a blood donor in any country that you are. If you literally put register as a blood donor, Sao Paulo, or whichever country you are in, you will find a place where you can donate blood. You find a place where you can sign up as a blood donor, volunteer for blood donation organizations because they really, really need your help. And for us, we would love if you can support us financially as well. We are always taking donations on our website, or in any kind of way that you would love to support us. But really would love most for people to amplify the message around blood donation. Whichever country that you're in, there's people that need blood. There's people that rely on blood transfusions to live, and it would be great if you can support
Absolutely.
them.
Especially again, if you are hearing us from the global south, consider go and donate. You don't know how grateful the people is gonna be, and usually you get the benefit that then if you or somebody close to you happens to need a blood transfusion, you don't need to donate. You already have this ticket.
Yeah.
So yeah, please consider, please follow the foundation. Please, yeah. And if you have the means, consider donation. It's always good. Perfect. The last thing that we are gonna talk about is well, actually, it's open. Do you have anything to tell anyone? That something that you want
Yeah.
to share?
I think what I would really love to share is that for people who don't have existing healthcare conditions, you are extremely lucky. I think that good health is something that everyone takes for granted until something happens to you or your family, and then you realize that, oh wow, like whatever plans you have today, the minute you're not feeling well, that plan is cancelled. Whatever it is that you think you want to achieve, the minute you don't, it's cancelled. And for people who live with pre-existing who lives with pre-existing health conditions, that dominates your life, right? Like, because everything you do is dominated by your health. So how you feel today will determine what you can achieve today or in the week and so on. And so if you have good health, you have to know how blessed you are and don't take that for granted. Don't mess up your health because there are a lot of people that are, millions of people in the world live with pre-existing healthcare conditions, and there's nothing they can do about it. Like, so many people live with conditions that have no cure, that you just have to manage. And so if you have good health, take care of yourself. Don't mess up your health doing all, whatever it is that you're doing, because it's really, really a blessing. So that for me is always my message for people anywhere in the world.
Yeah, from everything from mental health to physical
Hmm.
health.
Hmm.
Believe me, it's not the company is not gonna be grateful for you to have a burnout
Yeah,
and go down for 3 months,
yeah,
and the people around you need you. So if you have good health, if you have the means to not exert yourself into those levels, take care of yourself.
yeah,
Obviously, people that don't have the means, well, I hope things change for you as soon as possible. But if
yeah,
you have the means, please take care of you.
yeah.
Well, Bukola, thank you very much for being in the interview. It was a pleasure having you. Uh, and that would be
Thank
it.
you, Carlos. I really enjoyed speaking with you. And what you're doing is really great, super needed. Voices of the South matter, and amplifying the work that people do is just as important as the people doing the work. So well done to you.
Thanks. Again, it was a pleasure. I Thank you so much for staying with us after the episode. We would like to thank our patrons who are the main supporters of the podcast, and we hope to see you soon on the next episode of the Voices of the South.